Hi guys, welcome back to my Hi guys, welcome back to my YouTube channel. For those who are new, my name is Anne. I'm a nurse and thank you for choosing my YouTube channel. Yeah, for those who are returning, welcome back. We love you here and thank you always for choosing me. Yeah, so guys, I'm gonna shout out to all my new subscribers. Thank you so much for the love you're also showing me. Yeah, so today's video, I'll be doing more of a day in the life of a long-term care nurse. As you all know, I'm a nurse and yeah, I'm gonna share my tips that I use during med pass and so on. Yeah, so just an update to my new subscribers. I'm a nurse. I work in a long-term care nurse and I mostly do day shift, but I can pick a variety of shifts, but I kind of love day shift more. Yeah, so let's do this. Yeah. Also, I might be checking down because I have a piece of paper that I have my notes written. Yeah. So, first thing first. As a day shift nurse, the day can be so busy and stressful sometimes. As you all know, this is when most activities happen and most ADLs, the ADLs. What do we call ADLs again? Wait a minute. What's ADL in for? Oh, well. Oh, yeah. Activities of daily living. Okay. Where were we before ADL screwed me up? Oh, yeah. During day shift, this is where most ADLs are done and we have most appointments booked and sometimes, if not always, it's doctor's day. I hope I mentioned there is heavy med pass, like 2 to 3 med pass, and most of the time family members visit during the day shift. Yeah, and if you're not ready or prepared for success, you may end up having anxiety on top of your anxiety. Yeah, so what I do first thing when I report work, I do my narcotic count with a previous shift. I have to make sure that all my drugs are properly counted and we are not missing anything, and my key and my phone, I have to make sure that I have them. Yeah, so after the narcotic shift, after the narcotic count, I do a verbal shift report with the outgoing nurses and make sure that they walk me through any changes that happened to my previous residents and anything that I need to know. Yeah, blah blah blah. Yeah, before I forget, in a long-term care, we don't call them patients, we call them residents. So I'll be saying more of residents, okay? Yeah, so after doing the shift report with the living nurse, I check my 24-hour monitoring and my calendar. So I just familiarize myself with who has an appointment, what time, and what kind of an appointment. Is it a hairdressing appointment, is it a medical appointment, and blah blah blah. Yeah, so for the 24-hour monitoring in my facility, this is how it looks like. We always have residents who are on CPR, like CPR. In case a resident collapse, you have to initiate the 30 compressions and yeah. Actually, the CPR has changed. It's no more 30 compression. Just make sure you update yourself with how to do the CPR. Yeah. So on the 24-hour monitoring, you have those residents on CPR, you have your residents who are on pain monitoring, you have the resident on the bowel list like day 2 and above, and you also have those residents on precaution. So once you just check, once I check the 24-hour report, I now go do a verbal report to my incoming staff. Yeah, I have to have my PSW, my personal support worker, take notes of the appointments that is coming or who changed, and yeah, basically what I got from the shift report, right? So once I've set my PSW, they go back to the unit and start doing what they do, like the ADLs, and yeah. So after that, as a nurse, I come back to the nursing station, and we have a dictation room. I go there and I make sure that I don't have any new orders, and I make sure that there's nothing important that I need to know, like a referral to, like, yeah, you know what I mean? Like, I just have to make sure I don't have anything that I need to know that is not in the nursing, in the med room, right? Yeah, so after coming out the dictation room, I go now to my med room. Oh God, this is too much talking. Let me sip my drink. Oh, yeah, so where did we stop? Yeah, so once I'm in the med room, I have to make sure that my med card looks good. Like, I have to stock for success. Guys, so stocking for success, this is how it looks like. So my med card, I have to make sure I have a pill crusher, I have a pill crusher pouch, I have some small spoons, I have some medication cups, those small ones, I have a hand sanitizer close to me because we do wash our hands frequently. Remember, the first thing that can be used to prevent infection is hand hygiene. Yeah, so once I have my hand sanitizer, I have to make sure I have some applesauce, I have a box of Kleenex, I have some finger stick strips for checking blood sugars. I have to make sure I have the finger prickers, my glucometer, my gloves, and so on. Yeah, so I'm set for success, right? Yeah, and also this is gonna save you time from going up and down refilling things on your med card, right? Oh, I also forgot, I have to make sure that my med card, I have a pitcher for either with a juice or water, depending on what my resident prefers. Yeah, so I'm set, and my med card is set. The next thing I do, go do my bowel assessment. The reason why I do this prior to med pass is because, remember, this is long-term care, and most people get off their bed and they never go back. Some people have activities to do, and if you don't catch up with the bowel list in the morning, you're gonna miss it, and you may have to pass it over to the next shift. But who wants to do that? Do you think they love doing nobody's gonna do it if you don't do it. So make sure you do your job. Don't pass over most of the stuff, right? Yeah, so I do my bowel assessment, and I give fluids to whoever has the fluid, and yeah, I'm ready to do a med pass. Oh God. Yeah, let's sip again. Yeah. So guys, I'm gonna give you some med pass tips that you may use to succeed. First thing, know your residents. Some residents, they may need to do some vitals before you give them their medication. So you need to know, who do I need to give, who do I need to have their blood pressure done before MedPass, and also know who do I need to check their blood sugars prior to giving them their medication, right? So once you know that, you'll know how to plan your MedPass. Like, you'll have to go do your residents who are on diabetic medication first, and also you can give your levodopa resident you can. Okay guys, this one thing I learned about communication, especially when addressing people with disability. So we do use person first language to communicate respectfully. So what do I mean? You have to put the emphasis on the person first. Like, instead of saying levodopa resident, I should have said a resident with levodopa medication. You got this? I hope so. Give you residents who have levodopa medication first. Like, those medication you need to give them on time, right? Yeah. So also make sure you time manage yourself. This is not a rushing game, like who is gonna do a med pass quick and blah blah blah. So you just have to take your time. Take your time to perform all those patient safety. Yeah, so for this sake, we'll be doing resident safety checks. Yeah, one, before you pull up your med strip to go and give the resident, make sure it's the right resident, it's the right meds that you're giving them, it's the right timing, it's the right guys. We're nurses, and we know all the safety checks before giving medication, right? Make sure you perform all those safety checks, then you're ready to do your med pass. Also, another tip that I do while doing my med pass is make sure that I have a piece of paper or a sticky note on my med card so that I can take notes of whatever things I need to know. Like, let's say I did some vitals and I don't have to put them like immediately on their chart. I have to write it down so that if I go, when I'm done with my med pass, I can put it in their chart, right? Yeah, you can, the sticky note, you can also take notes of certain medication that needs to be refilled, that you cannot do it while you're doing your med pass, right? Just write it down, like, I need to refill my levodopa, I need to refill my Emolax powder, right? Yeah, just have a piece of paper to take your notes down. Another tip that I'm gonna give you is avoid disturbance. Because any slight mistake, like when you get disturbed, that's when you do medication error. Okay, in my facility, we have this chart, a piece of chart written on your med card saying do not disturb. But most of the time, people do disturb you when you do med pass. So it's up to you to tell them, wait a minute, I'm in the middle of doing something, to avoid making a mistake. Remember, you have a license to protect. And also, leave alone protecting yourself or your protecting your license. Your residents come fast, and you don't want to mix up their medication, right? Yeah, another tip is always prepare one resident's medication, administer it, and come prepare another resident. This is gonna prevent all that confusion, and you may not know whose medication is this, and you don't know who you have given whose medication. Yeah, remember, you have to protect yourself. Yeah, be a good nurse. Yeah, so once, oh my God, I don't think I can be a teacher. This is too much talking. Yeah, so you can now pass your medication safely now that you have gotten all the tips that I have given you. So normally what I do, I like doing my med pass. At least I'll be done with my first med pass by 9:30. Right? Sometimes it's so hard to do it at 9:30. Sometimes you can finish your med pass too soon, but make it a habit to administer your medication at the right time, right? You can at least do it an hour earlier and I think 30 minutes earlier and 30 minutes late, to be on the safe side, because some medication do interact with others, and at least we want to give it time so that when you do another med pass, your first med pass is already been processed. Like the body is now trying to, like we don't want to give the medication too soon, in that some medication do interact with others. Yeah, so before 10, I try as much as possible to do some vitals that are needed. I do some assessments, like other bowel assessments or other fold assessments, and I try as much as possible catch up with my documentation, in that by 10 I can take my break, right? Yeah, so in a long-term care, if you don't take your break at least by 10 or 10:30, you may end up not having a break at all. And we don't want that, right? Yeah, so by 10 I'm having my break, and I come back to the unit. I catch up also with my documentation, and I'm now ready for my second med pass. Yeah, so the second med pass is not that heavy as the first one. Most of the time, most of the residents have some trazodone or some painkillers like Tylenol. Yeah, it's not that heavy, and you can do it quick, but in a safe way. Yeah, so also at this time I help my PSWs. Like I do help those who have feeding, and those who need 1 to 3 stuff done. Yeah, and I also at this time during my second med pass, I also catch up with more vitals. I also catch up with wound assessment. I also catch up with either anybody who is on monitoring, either for fall, monitoring for hematuria, monitoring for any change of condition, and so on. So at this time is 12:30 to 1-ish. I come back to the nursing station. I catch up with my documentation. Remember, nurses, if it's not charted, it was never done. Cover yourself and document, right? Yeah. So once my documentation is at least done, I now check up my care plans, and I do any learning that, if I have time, I do my search learning. And it's almost 2 o'clock. My third med pass. Oh my god, day shift goes so quick. Yeah. So it's 2 o'clock, my third med pass. I now start calling any family member that needs to be called. And also, at this time, most family member come visit their loved ones, so you'll be rushing, talking to the family members, trying to catch up with your documentation if you did not finish. And yeah, and within a short time, it's time again to count your narcotics. Yeah, so guys, I do count my narcotic, getting ready for the next shift to come and get their shift report. Yeah, so guys, with all that said, that is how I spend my day as a long-term care nurse. Sometimes it's different, and others, they are way harder than others. Other days are easier than others, and depending with how much behaviors you'll be dealing with. And yeah, I forgot to mention this. I mostly work in secured units, and as you know, in the afternoon, most of them will be having all those symptoms, and most of them will be sundowning. So yeah, we'll be dealing with some behaviors. Yeah. So guys, that's basically a day in a life of me. Thank you so much for taking your time to listen to me talking. I know it was too much talking, but at least I hope you I hope you now see how it looks like to work in a long-term care nurse. And also, for all you nurses, I hope you're gonna take some of the tips that I threw in while talking or yapping. Yeah, and you can follow them for a good or a successful med pass. Yeah, so before I leave, I always make sure that I clean up my med cards. I love preparing the incoming shift for success, and make sure that at least I top up their spoons, their makeup, anything they need. I'm kind enough to do that. But yeah, so guys, that was it for today. If you loved this, please consider subscribing, share, and comment. And you can also leave a comment on what you want me to talk about next in my next video. Adios. I love you all. Mwah.